Hi everyone, welcome to today's Face Facts. Today we're talking all things cellulite, which is a big major bugbear of a lot of women. Today we've spoken about the normal things that you can do at home to help with cellulite, the things that won't work at all, surgical and non-surgical potential interventions, and we're breaking down some myths. Hope you enjoy this one. Hi everyone, welcome to today's episode of Face Facts. We are talking all things cellulite.
Our favourite thing.
Sophie's here with a bunch of questions and we're going to talk about something that I think affects a lot of people. Hit me, Sophie.
What is cellulite?
Okay.
Straight to the point. What is it?
Cellulite is a really common condition that is found in about 80 to 90% of women worldwide who are post-pubertal. So it's exceptionally common and it is an appearance that occurs in specific areas, including arms, sometimes abdomen, commonly in the bum and thighs. And it is where there's essentially tight fibrotic bands in the connective tissue, pulling the skin down into the connective tissue, and then fat or adipocytes in between. And the fat that's sticking out causes this dimpled appearance of the skin or orange peel appearance of the skin. We call that cellulite.
Okay. So are there certain factors that can cause cellulite?
So it's multifactorial.
Okay.
And it's really common, but it is a cause of a lot of distress of women. And essentially there's a play between hormones, genetics and lifestyle. So when it comes to genetics, it seems that there is a gene that predisposes some women to getting more cellulite than others. And it's also important to understand why men don't get it as much. The fibrotic bands for women, these strands of fibrosis when found in cellulite are vertical bands, whereas men have a crisscross pattern. So again, we can put a picture of what that looks like so that people can understand. There is skin, and underneath the skin, you have subcutaneous fat. And then you have a connection, like a toothpick, that goes from the skin to the fat to keep all the layers of the body tightly connected. And these fibrotic bands in between them, you have the fat bulging. So if you're vertical, if you have these tight vertical bands rather than crisscross bands, then you can get this uneven appearance or texture to the skin. Hormones. Estrogen has a huge part to play in it. And that's why we see it in post-pubertal women rather than, teeny weeny babies. Although some children also have it, like my little baby's bottom has a little bit of cellulite. So it is actually quite normal. When with estrogen, as we are aging, and it's also age-related, we know that you lose collagen, we know that you lose elastin, and estrogen also causes a redistribution of fat. So in a female, for example, the general body weight, 5% of the body weight comes from her abdomen in youth. Post-menopausal, 20% of the weight of a woman comes from her abdomen. So your estrogen causes redistribution of fat, which is why we are treating a lot of women and men actually for abdominal fat. It happens more as you age and it becomes harder to get rid of the fat as you age. So it's multifactorial. It's not one thing alone. As for lifestyle, yes, it seems that there is an increased risk of developing cellulite if you have a sedentary lifestyle. So you're sitting most of the time, you're inactive, you're not exercising. Blood flow is also a part of it. If you have fluid retention or reduced blood flow, then you're more likely to get hypertrophy of the fat cells becoming enlarged. So the fat cells is called adipocytes. And when those adipocytes become enlarged, they can stick out between those fibrous septi more.
Can you get rid of cellulite?
This, again, is something that has been extensively researched over many, many years. And the data does show that there are treatments that can positively impact cellulite, but it isn't a one-size-fits-all, and it isn't one treatment is going to work for every person. So there are various different treatments. There are invasive and non-invasive treatments. There are treatments that absolutely don't do anything. And again, it comes down to the physiology. And there was a recent systematic review that looked at all of the data available regarding cellulite reduction. And they concluded that whilst treatments do look promising, it seems that effects of the treatments are only kept whilst you're doing the treatment. So you have to maintain. So you can treat it. You can significantly improve it, but it's unlikely it's going to go away completely. And you may need maintenance treatments.
And in terms of treatments, I know I personally see lots of creams and this will get rid of your cellulite and this will do this. Do they work?
No. No. Creams that promise you the world and look too good to be true are too good to be true. No. So creams, there are very little evidence that creams help with cellulite.
Okay.
However, there is some evidence that caffeine and retinoids can help. How they help is interesting. So caffeine is a treatment that can help, or a cream, a topical, and orally can help with circulation. Okay. So if you have an improved microcirculation, then you are likely to have less fluid retention. That helps to reduce the appearance of cellulite.
Okay.
Retinol or retinoids, we've talked about retinols in a whole other podcast. Retinoids are clinically proven as the number one ingredient that we know works very well at improving epidermal thickness. So it can thicken the skin, and it can improve collagen and improve the appearance of lines and wrinkles. So if you have better skin quality, then it's likely that your cellulite will look better. So you can use body products that contain caffeine and retinol that can help with cellulite. Probably it will only help while you're using it.
Okay.
We've also heard about body brushing. Body brushing is another thing that can help with the appearance of cellulite. Again, also only whilst you're doing it. And that comes down to the microcirculation, the improvements in lymphatic drainage. And lymphatic drainage has been shown to significantly improve. Because when we are sedentary, when we're not working out, when we are sitting down, we're inactive, we get a lot more fluid retention. And of course, adipose site hypertrophy. So the idea is that you are increasing the circulation, you're improving the lymphatics, and that helps as well.
Okay.
But you got to have realistic expectations. Your cellulite is not all going to go away by brushing or by using a caffeine-containing cream.
Yeah.
Got to keep it real.
What about treatments that can help with it?
So we can divide these into surgical and non-surgical. Okay. Surgical treatments that have shown to have some efficacy include subcision. Now, there are many treatments that have come on market, fallen off the market, and again, it's a matter of much debate. But one of the treatments that can help is subcision. This is different to liposuction. Liposuction can actually make it worse. Why? It can increase the uneven appearance of the body. So liposuction can sometimes make the appearance of cellulite worse because it is a play. The reason why you have this orange peel appearance is because of the interaction between the skin, the connective tissue, and the fat.
Okay.
So it's not fat. It's not just fat. It's that connective tissue. And it's those fibrous bands. It's the quality of the skin. It's an interplay. And it's multifactorial. What can help is subcision. Subcision is when you go underneath the skin and you cut away those fibrous bands.
Okay.
So you can surgically remove them. And that releases them and creates a smoother appearance.
Yeah.
The question mark and the data has shown that sometimes those fibrous bands regrow. They reattach, and so the appearance of cellulite comes back. It's also a surgical appearance. It can be painful. You're likely to have bruising. So these are the things that you need to bear in mind. Another thing that can help is subcision with a collagen stimulator that can improve collagen and elastin, like Sculptra. So this has shown exceptionally promising results when used in the glutes and in the arms. And how it works is by creating inflammation and inducing a wound healing response. So you get more collagen production, you get more elastin, and you get more angiogenesis. Angiogenesis means more blood flow, more blood vessels, which will bring more blood flow. So you improve the quality, objectively improve the quality of the skin. At the same time that you're doing subcision means you have a smoother appearance. So you have a significant reduction. The thing to bear in mind with that is you'll need multiple sessions, usually approximately 3 sessions. Okay, spaced about 2 months apart. But that has been exceptionally promising and a helpful treatment for our patients in clinic. So those are what I would say are more invasive treatments because that involves taking a needle or a cannula into the tissues. And of course, we anesthetize you, so it's not horrific. Non-invasive treatments include things like microneedling radiofrequency. Now, this has been shown to help. And how this works is, again, by breaking up parts of those collagen fibers and re-stimulating collagen. So this is very different to microneedling alone.
Yeah.
And the reason why is because the heat that is generated from the radiofrequency is delivered deep into the skin and helps to break up old connective tissue and stimulate new connective tissue, new collagen. To what extent it helps has not been quantified. And we also don't know if the results are long-lasting, but there has been some promising data to show that radiofrequency microneedling can help to improve. And part of the theory is that, again, it helps to improve the skin quality. And because it's an interplay between skin and connective tissue and fat, if the skin is thicker, the skin looks better, then the cellulite is less of a cosmetic concern. And cellulite is a cosmetic issue. It's not a health issue, right?
Okay.
So unlike, for example, some people have excess fat between their thighs and that can cause chafing. That's a health issue. that's causing distress and also functional issues and pain. Cellulite is cosmetic.
Okay.
Yeah. The other thing that has shown significantly to help is emerald laser. This has been really interesting and I think has been a little bit groundbreaking as well and underexplored, under-talked about. So it is FDA approved, which means that it has received approval from the Federal Drug Agency in the USA. It's a medical CE mark product. It is a laser, so a true laser. And lasers are really, really interesting. So, because a lot of people think, how does that even work? I don't get it. It's just a light. Well, lasers, light, our bodies absorb light. And if you think of light as a wavelength, so it's this curly, whirly wavelength up and down, and there are little packets of energy that travel through this wavelength or through this light. They're called photons, okay? And your body has the ability to absorb photons because we have something called chromophores. Sorry if I'm getting too technical. Chromophores, which are pigments that can absorb certain wavelengths of energy. So anytime any energy comes to us in the form of heat, in the form of light, it gets converted into something. When light energy hits the skin, our bodies can absorb energy. We can absorb light. Even if your eyes are closed, your body can absorb light. So this laser hits the skin.
Yeah.
And this is a 532 nanometer true laser. It's a diode laser. It's a green light laser. It's non-thermal. So when light hits the skin, it can do a number of different things. Number one, it can cause a photochemical reaction where the light is converted into a chemical reaction and causes a chemical cascade. For example, let's take UV rays, okay? Or X-rays. You've heard of X-rays from the dentist, okay? This is a wavelength of light. And this wavelength of light is a very short wavelength, high frequency light. When it hits the skin or the body, it can go through it and it can cause an ionizing change. Now, stay with me. Let me explain what this means. Every atom in the body, every atom worldwide, in the middle of it, you have your neutron, your photons, and then on the outside, you have something called electrons, okay? And a stable atom has equal number of photons and electrons. An unstable atom has an electron that's come off, so it's unstable. All right? So this goes back to physics. So what happens when you have ionizing radiation? That means that the wavelength of light that is hitting the tissues has the ability to knock off an electron from the atom. Are you with me?
I'm with you.
Okay? So that creates an unstable atom. And that's why X-rays are dangerous. I'm not saying don't have an X-ray, but X-rays have to be prescribed. You can't do them willy-nilly, and there's a risk to the tissues, and therefore there has to be a risk-benefit analysis done, right? So when a dentist is taking an X-ray, when your doctor is taking a chest X-ray, they go, I'm putting this patient under risk because I'm putting ionizing radiation on them, and that's creating a photochemical reaction. It won't hurt you. You can have an X-ray, you won't even know you had an X-ray, right? It doesn't hurt you. It doesn't cause heat. Same as UV radiation. UVA, which is there even in dark day, in cloudy days, that UVA radiation is an ionizing radiation. This is really important that we understand this because then you'll understand how lasers work. And that means it has the ability to knock off an electron from the atom, create an unstable molecule, and that is called an ionized molecule. We know that unstable ionized molecules are more likely to mutate, and that's why we're at higher risk of causing cancer. Okay? So that's ionizing radiation. So now we can acknowledge that certain lights hit the body and can create a photochemical reaction. Some are ionizing, which are dangerous, and some are non-ionizing. Lasers are non-ionizing. They're not going to increase the risk of cancer. And then there's three categories. They can either cause heat, like, for example, endolith laser, CO2 laser, an erbium YAG laser. You put them on the skin, you feel hot. It feels hot. That's called a photothermal reaction. It takes the light energy, converts it into heat, and causes some kind of thermal event or thermal damage. Are you with me?
I'm with you.
Okay. Then you have, so that's photochemical, photothermal, and then you have something called photomechanical impact. That's when the light is coming at such a high speed that it doesn't cause heat, doesn't cause chemical reaction. It creates a sound, a photoacoustic effect, a sound, and a mechanical impact. It shatters the pigment in the skin. So it's used for tattoo removal. So now you know how lasers work. Let's go back to how lasers can help with fat and can help with cellulite. Green lasers are absorbed into the tissues. And this particular green laser, diode laser, is actually absorbed into the fat and into the skin. And it causes a photochemical reaction, not a photothermal reaction. Hence, it is a non-thermal laser.
Yeah.
It's a non-contact laser. It doesn't have to touch you. When it's absorbed by mitochondria. So one of the chromophores in our bodies, one of the things that are cells, let's say, or one of the components that are able to absorb light and convert it into something is something called C oxidase, part of our mitochondria. Our mitochondria are the batteries that are needed to drive the action of that cell. Every cell has it.
Okay.
Your hair, your brain, your skin. Inside it, it's got an engine or a battery. That battery or that engine needs fuel to work. Are you with me?
I'm with you.
As we age, we get mitochondrial dysfunction. So that battery or that engine can't work as well.
Okay.
So green laser, the emerald laser, enhances wellness. How? By improving C oxidase, by enhancing the activity of the mitochondria. So you get an expression and improvement in collagen synthesis.
Okay.
All right? And that's how you get tissue remodeling. And that is why it is approved for cellulite. It also helps to create a pore in the fat. So when you are, 20, you've finished growing, you have the number of fat cells in your body that you have for life. So let's say you had 100 fat cells in your bum. Okay. You ate lots of chips, you sat down all day, you ate lots of chocolate biscuits. What happens to those fat cells? You don't get more of them. You get, that fat cell expands.
Yeah.
So it's called adipocyte hypertrophy. It expands. When it expands and it becomes too big, it starts to leak out negative messages. So it starts to become unhealthy, creates inflammation in the body. With the emerald laser, it creates a pore in that fat. It emulsifies some of the fats. And then the triglycerides and the fatty acids leave that fat cell, shrinking it back down to a healthy, lean fat cell. That pore only remains open for about 72 hours. So it works in a dual modality approach. Yeah. And so what we want when we are taking out fat and when we're causing collagen remodeling is an improvement in lymphatic drainage. Sorry to interrupt the podcast. I am coming to you to say if you're enjoying this, then I would really love for you to like, subscribe, follow along, and share this with anyone who might find this useful. We are investing a lot of time, energy, and resources into bringing you the best of the best in education, all about faces, bodies, aesthetics, and wellness. And I want to continue to do that, but I need you to subscribe. And if you have any questions, if you want us to address any particular topics, then please leave a comment and we will certainly create videos for you to address those. Thank you, and I hope you enjoy. But one of the things that it will do, it will cause contraction of your calves, contraction of your muscles, which improves lymphatic drainage and microcirculation. So you're stimulating the whole body. So that is a game changer for cellulite. And I found that to be very effective for our patients. And I like to combine it with something called Body Balancer. Now, Body Balancer, pretty much everyone will have seen on Jennifer Aniston, and lots of celebrities are using Body Balancers. And maybe we can put a picture up here of what a Body Balancer looks like. Body Balancers are full body treatment where you sit inside this bodysuit and you switch it on. You know I love this.
Yes.
Every time I have time, I go upstairs and say, can I have some Body Balancer? It's a wellness treatment, really. It's fantastic post-surgical, but it's exceptional for cellulite and exceptional post-emerald laser in particular, because it essentially causes lymphatic drainage. So it's a manual lymphatic massage, a full body manual lymphatic massage, which significantly helps to improve microcirculation, lymphatics, and therefore also the appearance of cellulite. The important thing to understand with lymphatic drainage is it's great post-surgical, it's great post-treatment. You can have it when you're not feeling well. You can have it any time, but the benefits will only be there if you're having it. It's kind of like if you stop brushing your teeth are going to get unhealthy. Yeah. If you stop having lymphatic drainage, you're not going to have the benefits of it lifelong.
Yeah. So it's sort of, you need to maintain it, have it regularly.
Yeah. And it's, it's cheap and cheerful. Yeah. So it's affordable for patients to have, but it's a great treatment. And if you can't access a Body Balancer for whatever reason, then the next best thing is doing lymphatic drainage manually. Those can be sometimes more expensive, actually. Okay. I know lots of patients who go and have manual lymphatic massage, which is great, but of course you're then paying for somebody to do that. Yeah. And cost might be a factor there.
Okay. Is that where they sort of have the instruments that rub on the, they put pressure on?
Yeah.
Okay.
You can have lymphatic massages for the face. Okay. Great post-treatment as well, post-surgical. And you can have it just as a nice pick-me-up.
Yeah, I know the body balance. I always say it's like a big hug. And it's a nice relaxing. Patients often fall asleep while they're having it because it's so relaxing for them, and switch off from the world for half an hour, which is really nice for them.
It's a gorgeous one, yeah.
In terms of sort of hydration and nutrition, does that have an impact on cellulite?
Again, there's no real evidence about it. What we do say is the sedentary lifestyle. If you're dehydrated, you might have more fluid retention in certain areas of the body. If you're not eating healthy, and you're having a pro-inflammatory lifestyle, then that might also result in adipocyte hypertrophy. These are all factors that we believe are at play.
Yeah.
But at present, it's more theoretical than scientifically proven.
Yeah. And in terms of exercise, does that help keep cellulite at bay and reduce it if you do have it?
It does seem so, yes. And that might be because of the improvement in the size of the adipocytes. It also, I think, is attributed to the fact that you get muscle hypertrophy. So when you are exercising and you have an enlargement of the muscles, and with muscles, it's very important that you are using them. Yeah. And when they are strong and when they are hypertrophied, you're going to be improving your microcirculation in the area. Okay. So it does seem that has a significant impact and improvement in the appearance of cellulite. So yes, I would say having an active lifestyle is very much part of the treatment.
Definitely. And in terms of realistic expectations for patients with cellulite, how important is it?
I think it's really important. I think, look, there's no shortcuts to health, and there's no shortcuts when it comes to treatment of cellulite. And I think it's important to understand that it is multifactorial. Yeah. So one thing is not going to be the answer here. I would, for me, and you know how we are in our clinic, we're very holistic, I would say when a patient comes in for cellulite treatment, the in-clinic treatment of choice would be a combination of Sculptra, emerald laser, so Sculptra and subcision, emerald laser for sure, and body balancer. And you can do it either way around. You can have the body balancer and the emerald first, and then the Sculptra, which I prefer to do. I prefer to do it that way, and then do the Sculptra. And I say to them, active lifestyle. You know, it's kind of throw the kitchen sink at it. Yeah. But active lifestyle is absolutely fantastic. And the most important thing, we're not talking cardio, we are talking about muscle movement. So weightlifting, ensuring that you're getting some form of muscle hypertrophy in the area is deemed to be the most effective.
Are there any other treatments that can help with cellulite?
There is a new one that has come to the market, which is by Delio, called Solution. But that's very, very new. Okay. And the data on that is at the moment limited. So it's a matter of watch the space and we'll see.
Okay. Who knows next time?
Who knows, exactly. So, any other questions?
No, I think if we just round up again with your top 3 take-home points.
It's normal. 90% of women have it. Instagram is fake. The majority of people on there are filtered. And that creates this unrealistic expectation of what normal is. And I think if you hang out with a lot of women in real life, you'll know that it is normal. And do not use the exceptionally filtered women on Instagram as a benchmark, because comparison is the biggest thief of joy. Yeah. I would say get active. Do whatever it is that makes you feel good, whether that is reformer Pilates or running or weights training, strength training, get moving. The most important thing that you can do for your health is exercise. There's no debate about that, and there's no shortcuts. Our in-clinic treatments are there to support and are adjunctive and can make significant change. But I will never, ever, ever tell my patients that this is a shortcut or an alternative to a healthy lifestyle. Yeah. It's an adjunct. And it's an adjunct that you can unapologetically access. I've had cool sculpting. I've had emerald laser. I've had M-Sculpt. I'd do it 100 times over. But I'm also very keen on exercise and nutrition.
Definitely. Well, thank you so much for sharing.
Thank you for coming.